This meeting is being recorded.
Okay, good afternoon, everybody. My name is Adam Chaptelaine, Town Manager in the Town of Arlington, and this is our second virtual town forum today focused on our town's public health and public safety response to the COVID-19 crisis. Looks like we have nearly 80 attendees, as well as our panelists joining us today. And today we want to hear from our Director of Health and Human Services, Christine Bargiorno, who's going to talk about our public health response, both our planning and response to the crisis from its inception to date. We're then going to hear from our Emergency Management Director and Fire Chief, Kevin Kelly, who's going to talk about both our emergency management efforts as well as the Fire Department's preparation and response for this crisis. We'll then hear from Police Chief Julie Flaherty, who will talk about how the Police Department is responding on a daily basis to all of the issues involved in this COVID-19 crisis. And then we'll open it up to a Q&A for those of you participating. I've already received some questions in advance of this webinar, and we'll also be using the Q&A function within this webinar to be able to answer questions that you might have. If we aren't able to get to all of those questions, we will do our best to document them and then provide answers in follow-up to this webinar. We did get one question in advance of the meeting about the school department, and though today is focused on public health and public safety response, and we're not joined by representatives of the school department, I did want to share that question as part of this introduction and an answer, but also ask that we hold any questions about schools until we're able to possibly offer a virtual town forum in regards to the schools. But the question we received in advance on that topic was, what role can parents, students, and the community play in preparing a robust online learning platform in case schools don't open in September due to COVID-19? Also, can this online platform be used by immunocompromised students if schools open prior to a vaccine? And I spoke to the superintendent about this question, and she provided me the following answer. The school department is aware that it is possible that the opening of school could be delayed in September and that there could be further interruptions during the school year due to COVID-19, and will have plans in place for either possibility. The district also recognizes that there may be students who have underlying medical conditions that would prevent them from returning to school in the fall, and will be developing learning plans for these students should they be needed. So that was the response to that question. And again, we're going to try to focus today on the town's response from both a public health and public safety perspective. Finally, before we turn it over to Christine, I just want to say thank you to all of our panelists today for being here. I want to thank all of our frontline workers across town departments who are still providing essential services to town residents and doing their best to protect all of us in this crisis. And I want to also call out a thank you to the Select Board, currently led by Chair Diane Mahan, who have been strong supporters of the efforts being put forth by the town. And I know in particular, Chair Mahan has really been trying to push out a lot of information on many different types of media and channels to try to push out as much information as possible. So again, a big thank you to the board, who I know is supportive of this virtual town forum, as well as the efforts of our multiple town departments. So with that, I'd like to turn it over to Christine Bargiorno, who's going to take about 10 minutes to give an overview of where we started, how we have been performing, and where we are today. So, Christine.
Great. Thank you so much, Adam. So I'd first like to just start by introducing myself. So I'm the Health and Human Services Director here in town. I've been with the town for nearly 2 decades. It's been a great 20 years almost working here in Arlington. And I will say that I've worked through a number of incidents that many of you that have been around for quite some time may remember, including we had anthrax in the early 2000s, we had SARS, we've had H1N1. Recently there was the Ebola situation that came out of Africa, and through all of those those experiences through all of our planning and public health, I can say that, you're never ready for a real pandemic when it hits, but, we've trained, we've practiced, we've received lots and lots of opportunities to do exercises and planning for these types of situations. And so, I can confidently say that the team we have here in our department has had a number of opportunities throughout the past few decades to also have that same training. So I'll start from February when we began working on coronavirus and receiving updates from the CDC and the World Health Organization. So some of you may remember that there was conversation in January about this new novel virus that was starting in China. And it was about early February when the US, the CDC began monitoring travelers that were coming from areas that were most impacted. So travelers that were coming from China. And so in the public health department, and we've done this for many types of viruses, including Ebola and other viruses that may be spread by people that are traveling throughout the world. But what happens is the CDC dispatches employees to various airports, and they're monitoring people as they leave the airplanes. And so we received a few travelers that were Arlington residents that were coming off planes from China in early February. What we did, and this is what we do in public health, is we receive that information through our online epidemiological network, which we call MAVEN. It's the Massachusetts Epi Network. And what we do is we follow those residents. So we contact those residents and we essentially quarantine them. So they're required to, and for this particular virus, they were required to stay home and monitor symptoms for 14 days from their last trip from China, from their flight. And so those handful of residents that we were monitoring did not show symptoms. We closed out each of their quarantines. There were no issues with those travelers. The federal government then added a few more countries. They added Iran and South Korea. It was right around the time when we learned of the Biogen conference. And it was early March that our leadership team began coming together and talking about our plans, our local plans for pandemic preparedness, what we plan for, what we work our entire careers to make sure we're able to respond to. So we met as a leadership team, which you see the group in front of you, as well as others that are leaders across the town. And we began talking about what our response would be to this novel virus if it were to become an issue here in Arlington. It was around that time that we also began looking at what was happening in other parts of our country. So we saw a lot of nursing homes and senior living care facilities being really impacted by this virus. Lots of information was coming out of the World Health Organization, the CDC, about this virus, and we were continuously monitoring as a leadership team the information that was coming out of those resources. Our fire department reached out immediately to our senior living facilities to determine what their plans were in order to address issues that would pop up, that we expected to pop up in those facilities. So if there was a case, what was their response? And so it was at that point that our fire department began really looking at that because our fire department also works as our EMS provider in our community, and they transport people from their homes or their residences to the hospital if they need it. And so based on information we were seeing from the West Coast here in the US, that was a really important area that we needed to focus on. So it was around March, the beginning, the second week in March, when we received our first notification of a positive case. And again, that was a positive that was related to the Biogen conference. So no travel history to China. And so that was something that we started seeing pop up around the Boston area. That one individual then, a family member of that individual also then became a case as well. So we had about 3 cases in the second week of March. So when I want to talk a little bit about contact tracing, because I think that's a term that's being used a lot now in our media, that people are hearing a lot about. And it's something that in public health we've used for many years in order to control disease. We've used it to control tuberculosis, whooping cough, Salmonella, E. coli. I mean, we're using this concept, this process to control disease so that you as the public never have to worry about diseases. And so this is a process that our public health nurse and our public health team work through every day to control disease. So for this particular virus, the way we began looking at cases, we would look at our case, and based on the science, we would look at all of the people that they came into contact with while they were symptomatic, because at the time that was the information that we were made aware of as their infectious period. So all of the people that they were in contact with during their infectious period were quarantined for a period of 14 days. And so some of you may remember we had to close a school in town in order to start gathering all those contacts. So we closed one of the schools down for one day in order to gather all those contacts, quarantine them, and then we reopened that school after a deep cleaning. And then we subsequently ended up, as you may all remember, we ended up closing schools in town for the beginning. I believe it was the end of that week. So it was that Monday, that March, I believe it was March 9th when we really just kind of kicked it into high gear, and we just began quarantining cases, doing case contacts and quarantining people. And so when we quarantine a resident, so if a resident comes into contact with a positive case, we quarantine those individuals for a certain number of days. And then we monitor their symptoms. We connect with them and make sure that if they're showing any signs and symptoms of the virus, that we're immediately referring them to testing or asking them to then provide us with their contacts. I will say that in the early stages, we were quarantining about 30 to 40, it could be 30 to 40 contacts per person for a positive case. And just recently, what we're seeing now, because of the stay-at-home advisory, there may be one or two people that are quarantined. And so that stay-at-home advisory has really been helpful in helping us to control the spread, to control the further spread of this virus. So I will say that our contacts have gone way down. And we're really appreciative of the residents in this community that have really followed our stay-at-home advisory, because it is important that if someone does become ill, that we don't have to quarantine more and more people. It is definitely a lot of investigative work on our department, which we actively do, but it's also it's a lot to ask someone to stay in for 14 days because of and to monitor their symptoms because they've been in contact with a positive case, because that is something that can be extremely scary for people. So we've seen our quarantine numbers, our contacts decrease because of our stay-at-home advisories. So I would say that, as of today, around noon today, so we get cases that come in throughout the day. So as of noon today, we had 187 cases and 19 deaths. And so those deaths range in age from late 50s up to over 100 years of age, and all different, male and female. It's really split down the middle. And, we're constantly reviewing our data, trying to determine, where are there gaps? Where can we work harder? We've identified our 3 senior living facilities as really sensitive areas. As I mentioned, in early March, our fire department was reaching out to learn about the plans that our senior living facilities have had in place. And we've worked closely with each of the facilities, the managers of those facilities. We're on daily calls with them. We're also on daily calls with the Department of Public Health, as well as our fire department and our EMS provider, Armstrong Ambulance, to try to come up with every possible scenario to try to control the spread of this virus within those 3 facilities. We've also worked closely with our housing partner, our Arlington Housing Authority, in order to make sure that we stopped all visitors at the facility. We have provided fabric face coverings to every resident and really put in some strict preventative measures early on in order to try to prevent any cases from starting in those facilities as well. Those are residences. Those are not assisted living facilities. So, it's a little bit more private, and it's just like a regular apartment building, but they're publicly funded. But we still maintain that really active relationship to make sure we control the spread in those facilities as well. What we've learned about this virus is that it is incredibly contagious. And so once it's in a facility, we have to work so hard to make sure we think about every possible way that it can be spread. And so we've worked really hard to try to figure out, what steps can be put in place to prevent the further spread. And, it's definitely something that we continue to work on, and we continue to ask the state for resources for. And we also, like I said before, work daily with the administrators of these facilities. I think what I'm most proud about in my role here as the Health and Human Services Director is the team that we have working in the health department, and then also just the team that we have, the leadership team that we have in town. I think, I'm really proud to be part of this leadership team. I think we have an amazing town manager. We have a great fire chief, police chief, and directors of various departments that we work with every day. We meet daily to do updates and figure out what strategies we can put in place to further control the spread within our community. And I have to say, I'm proud to be a part of that team. I think, there's not a minute in the day that goes by that none of us aren't thinking about what's happening, what we're doing, what's next, thinking about each other, making sure we're okay and we're healthy and safe. It's been a very trying time, but it's been an honor to be a part of this community with this team. So I'm sure I've missed points that I'm happy to answer in the Q&A, but I think I've probably gone over my time. So I want to pass it off to the next.
Great, thank you, Christine. That was very, 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 very helpful. So next up, if we still, I know that the fire chief was struggling with a little bit of technical difficulties, but if he's with us, he's with us. I'll introduce Fire Chief Kevin Kelly, who's going to give an overview of the efforts of the fire department.
So good afternoon, everyone. So just a quick introduction about myself. I'm a long-time resident of Arlington. I've been on the fire department for coming up on 26 years now, and I took over as the chief 9 months ago. Perfect timing. So I thought I'd start with what hasn't changed operationally here at the fire department. We're still currently staffing at a 15-person minimum. So every day we're fully staffed. All 3 fire stations are open. We have the fire station in the center. We have the fire station up around 1000 Mass Ave. We call that Highland Station. And then we have the Park Circle Station up by the water tower. We're still running all 3 engines, our ladder truck and our rescue. And the reason we're able to do that is because we've been fortunate. We have yet to have any of our members test positive for COVID. So we're fully staffed and doing well. So that's good news. Our call volume is currently the same. We haven't seen too much of a change in our responses. But what has changed, and what will lead me into my next topic, is the nature of our calls. I'll give you an example. This past weekend, we had 17 medical runs, 9 of which were COVID related. So that is a change. So we are seeing a change. So what has changed operationally? The first 2 things I'll discuss, you probably wouldn't notice. And this is all in response to the COVID event. I have quarantined all 3 of our fire stations. And what I mean by that is they're all operating separately from each other, staffing-wise. Traditionally, we would have people, if they took an overtime, who work at other stations. We're not doing that. So if you're assigned at fire headquarters, you can only work at fire headquarters. You can only take overtime at fire headquarters. And we're also screening all of our employees twice a day. So when an employee reports for work in the morning, they're getting their temperature taken and they're being asked COVID-related questions. We do that again at 5 o'clock at night. The reason we do that, again, we're trying to limit exposure and cross-contamination amongst ourselves. The next thing that you might notice if we've responded to your home or see us in action out on the street is, first of all, when you call 911 now, you are going to have COVID screening questions. It doesn't matter the nature of the call. 911 dispatchers have been asked those questions. So if we're coming to your home, even even for your smoke detector going off, you're going to be asked if there's someone COVID-related questions. Next thing you might notice when we arrive is our one-in approach. That is a big drastic change. In the past, you might see if the ambulance and the engine showed up, 5 members walking into your home with different type of equipment in their hand. Now what we're trying to do is send one person in PPE to engage, and engaging at a distance at first. That's new for us too. We might be back a few feet asking some questions first, just to get an idea of what's going on. The next thing we're doing on all calls, which is new, is we're placing a mask on all patients, no matter what even if you call us for you stubbed your toe, we're going to put a mask on you and engage at a distance at first. And then also what we're going to be doing is asking, if possible, to meet us outside. Either meet us at the front door or meet us outside. And I think what you maybe notice from all these things, it's all to protect you and us. We're limiting our exposure, limiting the amount of people we're engaging, and limiting the amount of people that you will be encountering with us. Again, it's to protect not only the firefighters, but to also protect you. And one thing I want to ask is, if you come one and you're not asked the questions, that can happen sometimes, to offer up that information. So if we're coming to your home for assistance, if there's someone in your home that's either tested positive, whether it's the patient or yourself, or that's being quarantined or isolated, just to let us know, just so we can take those extra precautions when we arrive. Challenges we've been facing. The first one was PPE. So when the event hit, now PPE is our personal protective equipment. The unknowns, the supply chains were really did, but I'm happy to say 6 weeks later that we're really in good shape. We have what we need to respond appropriately with caution, and to keep both the safety of the first responders and you in hand. And then the second challenge, and it really, I think you relate to this, it's just the information challenge. So much information has been pouring in. We're just thinking differently just from 6 weeks ago to now, just based on the information we're getting. So we're constantly adapting, constantly changing based on what we get from either the federal government or the state government, or even from the town on Board of Health. So I'd just like to end with a thank you to everybody. We've got nothing but positive feedback out in the street. The members are constantly telling me how appreciative everyone says they are to the fire department, the police department, and everyone in town, and how we're handling it. And we're all in it together. Remember, keep practicing your social distancing, wearing your masks, and stay safe. Thank you.
Thank you, Chief. That was very informative. I appreciate it. Next, we have Chief Julie Flaherty from the Police Department to give an update on the activities of the Police Department in this crisis.
Thank you, Adam. Hello, everybody. I'm Chief Julie Flaherty from the Police Department. Thank you all for joining in today. I just wanted to take a few minutes to talk about some of the things that we're doing to keep the residents of Arlington safe, and also some changes that we've made within the Police Department to keep our offices safe. We're still open 24/7. We're still out on the road patrolling and responding to calls. If you have any type of emergency, as always, you should call 911 and you will get a police response. If you need police assistance, our front lobby is still open. You can come in and you'll be able to speak with an officer behind a glass window to report any type of crime or to file a police report. If you'd like to file a police report and speak with an officer, you can call our non-emergency number, 781-643-1212. We've been taking some police reports over the phone from some of the residents, and we've also been directing some people to file police reports online, and that's on our website at arlingtonmass.gov on the police page. It's a simple process, and an officer will follow up with you within 24 hours of reporting. The department's clinician, Rebecca Wolf, is still very active in co-responding to calls when she's needed to. She is following up with residents who need her services, and we've been continuing to work with our most vulnerable populations. We've recently added a list of resources on our website for people who are in need of behavioral health services or who are in need of substance use assistance. And we've also put information about anybody who's been a victim of scams, or we also put something up recently for those in need of domestic violence services. We have made some changes in the police department to keep our offices safe. We've changed some of our policies and protocols. We're no longer doing a physical roll call like we've always done 3 times a day. We're having officers report directly to their patrol cars and using technology to give out assignments. We've also been requiring our officers to wear masks anytime they're interacting with anybody in the community, and to maintain distance if that's possible. As well, along with the fire department, we're taking officers' temperatures when they report to duty and asking a series of COVID-related questions. So far, I'm happy to report that we've all been able to stay healthy during this. In the event that we do have officers who become ill, we have a plan in place to continue our services. We're very grateful to those in the community who have been adhering to the signs and recommendations and not using our parks and playgrounds. We've been responding to a lot of calls from concerned citizens about people congregating in parks and playgrounds still. So we really need the community's help to get the word out. Our parks and playgrounds are closed, and we really need people not to congregate to keep everybody safe in the community. We've been receiving a lot of calls about people trespassing on the PS school, PS field, which is the playground, the park behind Arlington High School. The fence is locked, the gate is locked, so people are climbing the fence to get in. And we really need the community's help to stop that behavior, to keep everybody safe. We're also asking our dog owners to pay close attention to the off-leash hours. Our off-leash hours in town are 6 a.m. to 9 a.m. And we've been receiving a lot of calls from citizens, and our officers out in patrol have been seeing people not adhering to those hours. So we really need the community to work together. We've also received some inquiries about what the police department is doing to protect our most vulnerable populations and our Asian American population. I'd like to say that any type of hate crime or hate incident will not be tolerated. We are vigorously investigating all claims of hate and bias, and we encourage any person who's been a victim of a crime or any type of incident to report it to the police department right away. As I mentioned, there are many ways to report these incidents. We have a text-a-tip that you can find the information on our website about. We have online reporting. You can call 911 or call the police department. We can't respond to these incidents if we don't know about them, so we encourage anybody who has been a victim to get in touch with us. The final thing that I would like to say is that the community has been very supportive, and the police department is very grateful for everything you've done to show support for our first responders. The men and women of the Arlington Police Department are here for you, and we will get through this together.
Thank you, Chief. So that wraps up the presentation portion of this webinar. I want to note where I think the highest number I saw of attendees was 137. We're at 136 right now, so we've got great participation in this webinar. So I'm glad you're all here. And again, thank you to Christine, Julie, and Kevin for being here today to provide this information. So we want to move to Q&A. So we have the Q&A function via Zoom. We also received a few questions before the meeting that I want to start with those, and then we'll go into the Q&A function. A few of these questions that I received were answered as part of the presentations from our speakers. But I want to ask Christine a question to start. Christine, is there a plan for coronavirus testing in Arlington? If so, when, and would it be available to all residents? If you could take the first shot at that.
So many of you have heard that coronavirus testing has been slow to be rolled out across the country. There has been a nationwide shortage of tests, testing swabs in particular. So we are really relying on the equipment and the kits to be sent out. So in order to do universal testing across the community for all residents, we would really need to work closely with our state leadership work closely with our neighboring communities to make sure that we have enough access to the kits that need to be used in order to do those tests. We've worked very hard to make sure that our the populations that are most affected are receiving those tests. That's where the focus is currently. So our senior living facilities, they are definitely on that list, as well as first responders, and now state has added grocery store clerks as well as obviously healthcare providers. So we do have to rely on the state in order to determine who the next group of individuals are. And I think that won't really open up to the entire community until there is enough equipment to do that. So obviously we would be ready to jump into action once that's available, but at the moment it's just not feasible.
Great, thank you, Christine. Another question that I think would go to you, Christine, that I know you and I have been seeing in terms of people writing to us via email, but question about landscapers. This resident asked, I've seen landscapers about town working, not practicing social distancing. This seems unsafe for them and for other passersby. Why are they deemed essential workers?
So we definitely have gotten this question a lot in this office. And so the state has developed a list of essential workers, and those workers with protections in place are able to continue providing services in communities. Now, landscapers aren't necessarily part of that essential list. However, there is a provision which allows landscapers to provide services because they're not in a facility. So they are not in a bricks and mortar type of facility, which would, if they were working in a facility such as that, they would not be able to be in operation. But because they're working outside, they can. So with that, we worked closely with our landscapers in our community to make sure that they were following the strict the social distancing, that they had the appropriate resources to make sure that their workers were safe. So we the same goes for many other types of essential services. So, the two chiefs explained the different strategies that they have in place in order to control the spread of the virus within their groups. So we try to apply those strict social distancing across all different work environments, including construction. I think that's another one that we get a lot of complaints about. And so making sure that our contractors in town know what the requirements are in order to prevent the spread of the virus. So we've done a lot of work internally in this department to make sure we work with the community and workers and business owners in town to prevent the further spread, as well as town departments. There are some essentials town departments that also need to continue running. And so how do we make sure that they're able to provide their service safely? So we've done a lot of work directly with those various groups.
Great, thank you, Christine. I just want to note I'm seeing some participants use the raise hand function in Zoom, and we're performing this as a moderated Q&A via the Q&A feature. So if you do have a question, if you could please input it into the Q&A, that'll be the way we'll be taking questions for the remainder of this event. So I'm going to move from the questions we received via email into the questions we're receiving in the Q&A. And the first one, again, Christine, I think you're going to have the lion's share of these today. How do the CDC notifications, which clearly must include personal identifying information, PII, and the town's handling of them, comply with HIPAA privacy requirements?
Sure. So the information, the positive test results come in through the State Department of Public Health through our mass virtual epi network. So that's MAVEN, which many people know that system. When it comes to protecting the health of the public, there are certain areas that we in the public health department still need to continue to push forward on. And one of those is when we have a positive case, we reach out to the case and we identify who their contacts are, and we then contact those contacts. We don't say who their contact is. Oftentimes, if it's a close family member, they know who the contact is, but we don't release that information. So we do keep the privacy of the positive case private. However, we do have to make sure that we protect the people that they may have come into contact with. So HIPAA does apply. However, public health and safety are incredibly important in making sure we control the spread of the virus. I don't know if that answers that question. But.
Yes, thank you, Christine. I'll go to a question for Chief Flaherty. Chief, are police vehicles sanitized between shifts or at any point during the day?
Yes, they are. So we have a sanitizing machine at one of the firehouses, and we have somebody from the school department who's staffed every morning. We bring the cruiser there and they're sanitizing them. We also, each officer wipes down the vehicle at the end of their shift and at the beginning of their shifts. So daily they are being sanitized.
Great, thank you very much. I have a question here we may need to talk to this person directly to help them out, but Christine, this person's asking, am I violating Massachusetts health guidelines when I continue to visit my partner in Arlington, if he continues to visit my family? This person lives in Newton. My partner owns his own home office and he has no roommates, has his own entrance, and no one besides me and my partner have access. We sanitize mail and groceries at both houses. Sounds like this question is, if you're visiting just one person who lives in a home that's not your home, how do we feel about, would we make a recommendation in that regard?
It does sound like a very specific personal question, and I'm happy to answer that offline. But I think in general, we want to make sure we're controlling our family unit as much as possible. So if this partner is if you're considering this a close family partner, I think in this situation, we would just suggest that be your only person you're in contact with. So you want to just control the number of people you're interacting with. So if it's just that one person, I think that's fine. I think it is important to always consider where else that person's going and where else you're going. And if that person's of a certain age and has any underlying health conditions, and making sure that you're really protecting yourself and that person as well. Fabric face coverings, that's a popular way to control the spread. So, as you go out in the community, making sure that you're hand washing, fabric face coverings, and just limiting your interaction with people outside of your strict family or strict unit.
Great, thank you. And I just asked that attendee to email us if they had further questions, if they'd like to discuss that, their specific situation further.
Great.
Another question that I think will go to you, Christine. With the cases of workers at local stores having been diagnosed, have the companies been notifying the town about these positive cases?
So the way that positive cases are reported, if somebody tests positive and they don't live in Arlington, the health department in that community reaches out to the community where that person works. So for example, if someone works in Arlington, but they live in Bedford, we're going to get a notification from the town of Bedford that that person works here. And then we reach out to the workplace and we start doing their case investigation there. There have been a number of individuals in our community and other communities that have maybe not tested positive, so they haven't received a positive test, which would kick this whole process into gear. But what they are getting is a diagnosis from their physician over the phone. So they're calling their doctor and saying, I have these symptoms. And they're maybe just told by their doctor, you sound as if you have COVID-19. We're going to ask that you self-quarantine. So in that situation, and there are thousands of those calls happening all of the, throughout the course of the week, we're not getting those records. So there have been a few individuals that we've been notified of that are possibly falling into that category. We've worked with the establishment to make sure that there are strict cleaning guidelines in place and that they're taking it seriously. However, we're not, we don't have information about cases. So we're just sort of told in passing that there may be a case, or we may get a call from the media. But we're not getting reports of positive cases within these facilities. So,
great, thank you. Here's a question. Thank you for all your hard work in keeping us safe. Belmont made face coverings mandatory for people in public earlier this week. I have noticed that the adoption rate in Arlington is probably no more than 20%. Are there any plans to require face coverings for people when they leave their homes? Also, I see delivery people and mail carriers not covering their faces while working. They often come into closer contact with people at their own front doors, and they are visiting many locations. Is there anything to be done, and how would it be carried out? So I guess I'll start by saying we have received guidance from the Attorney General's office that cities and towns cannot mandate the wearing of face coverings or masks whenever you leave your home. So to date, we have been following that guidance. However, we've learned that via the actions of some communities and questions from many communities, the AG is taking a closer look at that and maybe coming out with further guidance in the next few days. So I think we are positioned to want to mandate at least face coverings when people leave their homes if we feel as though we have the legal ability to do so, but we're waiting for that legal clarity from the Attorney General's office. Christine, would you like to comment on delivery people or mail carriers?
Sure. We've definitely had conversations with the postmaster here in Arlington. We've offered facial coverings for the staff in that facility. We've definitely made recommendations, strong recommendations. We've sort of, our department definitely came out ahead of the face covering recommendation. We were providing face coverings or fabric masks to our seniors in our community. So we do see the value, and we are hopeful that we are moving in that direction and making sure that we support that. So.
Great. Thank you, Christine. Next question. I think I heard Christine say that there are 187 cases and 19 deaths. Isn't that an exceptionally high death rate? And if so, do we have a theory about why?
So here in Arlington, we had a situation where we did not actually have access to tests early on, and that was related to the shortage of testing nationwide. So one of our hospitals that our residents feed into, so the BI system. So Winchester Hospital, Mount Auburn Hospital, and Leahy, those hospitals didn't have testing. So we lost out on the possibility of having many, many more people in our community test positive. That would have shifted the numbers. So we don't feel as if our numbers are true to the number of cases that we truly have in Arlington. We have seen a number of our deaths in our senior living facilities. We have a higher rate of seniors in Arlington than most communities in the Commonwealth. Actually, we have a significantly higher rate of seniors in Arlington. And so, I wouldn't say that the death rate is exceptionally higher. I just think that we haven't had the adequate testing in place in order to truly understand the severity of the spread within the community. So had we not lost that week of testing, when testing was shut off in those facilities for that week, we may have, hundreds more similar to other communities our size in other parts of the state that actually their hospital systems were able to do the testing. So I think, it does feel like a high number compared to the number of cases.
Okay, thank you, Christine. Next question is, I've heard different rumors about the National Guard coming to Sunrise and the outbreak there. Can you speak directly to this issue?
Sure, yes. So we did put out a press release last week notifying the community that the National Guard was coming to town. So the National Guard has been put in place in many communities across the state to provide universal testing at these senior living facilities. We were really looking to have all of our residents in these senior living facilities tested so that we could get a good baseline of how many cases we're dealing with in order to help figure out how to best restrict movement within the facility. So if we knew who was positive and who was negative, we would be able to help the facility identify, PPE that they would need, some staffing requirements that they would need in order to just adjust slightly to prevent future cases. So the National Guard was called in to work to do testing at Sunrise. The National Guard provided testing kits to Park Ave, and Park Ave conducted the tests at their facilities. So both of those facilities have had universal testing across all staff and residents. And that's why we were able to get a better handle on how far this has spread within those two facilities. So it's not a rumor, it did happen. They've been an amazing resource for communities. And we're very thankful that we had that opportunity to partner with them to have them come into Arlington.
Great, thank you, Christine. Another mask question specific to runners. Can you talk a little bit about our thoughts on trying to get more runners to wear masks?
I think having runners wear masks, that's a great idea. We've definitely talked about in our leadership team how to reach out to running groups and bicycling groups. So yeah, I mean, there's more to come on that, but I think as the weather gets warmer, we're going to be seeing a lot more people out exercising. And I think that is definitely on our list. And hopefully we can provide more guidance to those groups.
Great, thank you. There seems to be a need for people who have had COVID to donate plasma. A friend likely had COVID, having been exposed to someone who tested positive, but was unable to get tested weeks ago. Can she and others get tested for the antibodies and donate plasma?
So there is information on the Red Cross website about doing that. So we've been referring residents that call in, offering their blood, their platelets. We've just been referring them to the Red Cross. So they do have a page up on their website. And I think that's something that we thought may be helpful for us to put on our website. So maybe we'll do that. We can talk to our PR person to make sure that our website reflects the link to the Red Cross plasma donation.
Okay, thank you. Question for Chief Flaherty. Chief Flaherty has reported elsewhere that while traffic accidents have decreased, the incidence of crime has increased. Could she please speak to what kinds of crime have increased and ways Arlington residents can address this increase in terms of reporting and prevention?
Sure. I did report that we looked at the time from I believe it was March 14th, 2019 to April 14th, 2019. And I think the number was, we had about 36 or 37 motor vehicle crashes. We looked at the same timeline this past year and it was significantly reduced. And we chalked that up to being just far more less vehicles on the road, schools closed, people working from home, and we're just not seeing cars on the road right now. As far as the crimes that we're seeing an increase in, we're seeing a lot of assaults. We're seeing a lot of domestic violence incidents, people calling in with behavioral health concerns. And there's a whole list of crimes that we report to the FBI that we've seen a small increase in, looking at that same time period in 2019 and again in 2020.
Great, thank you, Chief. Another mask question for you, Christine. I continue to see grocery store workers without masks on. What is the town directly doing to assure follow through in these stores?
So we've actually provided resources. So we've provided masks to all grocery stores, and we have required that they wear them while they're working. And so, if people do see clerks in stores not wearing them, please call us, because we will be right out there. We've provided masks to convenience store workers, grocery store clerks, people working in the grocery stores. I think from what we're hearing is that grocery store clerks do want to wear them, and they have wanted to wear them for quite some time. And our requirement for them to wear them has it's been well received. So if you are seeing them out there without masks, please let us know. Please call us. We'll be right out there to inspect and provide the resources they may need.
What number should people call if they see that?
So you can call the health department office, which is 781-316-3170, or you can email us. We are working around the clock here at the health department, so always ready to respond.
Great, thank you, Christine. Question here that I think might be for Chief Kelly. Very happy to show support for all first responders, police, fire department, and other healthcare workers. But there was a big rally on Warren Street last week with a big crowd all packed together and no masks. It sounds like it was a fire truck rally. I'm not familiar with that, Chief. Was there some type of fire truck event over the weekend?
Not that I'm aware of, but if you say Warren Street, I know the other day there was a nurse that was going to work, and they're calling them, I don't know, clap offs or something like that, where one of the COVID nurses going to work, and we certainly wanted to support that. So our crew was there for that. So if that's what you're talking about, then that's what that was. We certainly, even in those events, we've done some birthday, some of the younger kids' birthdays, we'll get into a line of cars and drive down past the house with the lights on. We've been participating in those things. So it certainly could have been one of those. But even when we do those, we do, at least tell our members that we still have to practice social distancing, wearing masks outside and those kind of things. So that there might have been either a birthday party or that nurses send off.
And was there something called One Day Boston? Could that have been? I'm not familiar with that either, but.
Yeah, and neither am I.
No, okay. We can look into that.
Yeah.
Christine, is there any update on what we are doing to protect our essential workers? For example, are we performing extra sanitation efforts on our bus stop benches? And I guess I would add, and do you think we should be if we're not?
So the town of Arlington is not doing that. I would have to check with the MBTA to determine if they are. I mean, should we be? I don't know if I have the answer to that. I know that the numbers are down. I think the benches in at bus stops, it's just hard to say. I think we would have to just consult with the MBTA. It's definitely something that I haven't actually thought about. Happy to have that conversation offline.
Great, thank you, Christine. Question: I have a neighbor who hosts visitors. Earlier this week, they had a visitor who brought his 3 kids to play with his kids, and the 5 of them were all out on the street. Should these incidents be reported / investigated? So, I mean, I'll answer in saying, that is the exact type of behavior that we are asking people to refrain from. How do you, I guess, Christine, maybe Julie, how do you feel about residents calling in to report that?
So we've been getting called to incidents like that, and we're trying to advise people and educate people that we'd like to see that practice stop to keep everybody safe.
Okay.
And just from a public health perspective, I think it's important to note that we're all in this together. We have been doing this for the past 5 weeks, and the more we can abide by what we are asking of residents, the better our chances of getting out of this sooner. So we are seeing our numbers not going as high as we would have expected based on what we saw in Europe. And I think a lot of that has to do with the work that we're all putting in. We're all struggling. I mean, it's not easy, and we get it. But it is so important for people to not be going outside their immediate family unit, and canceling the schools for the remainder of the year that, the governors did that. These are all steps to save lives. We are seeing that in Arlington, although we had that lack of testing, our numbers are not what we would have expected if we hadn't done. We are seeing good results because of the work that's happening and the work that everybody's putting into this. So by going outside of your immediate family unit, you're really putting a lot of people at risk. Seeing 19 deaths I'm not proud of that. I think, the number isn't as high as it could be, but it's also not where it should be 0. And if we all take this seriously, we can keep that at 19. And I think it's just important to keep that in mind.
Thank you. So we have, we'll try to maybe take 5 more minutes of questions before a brief wrap up. Again, to Christine, does the town of Arlington or the Commonwealth have any structured guidelines for work done and procedures after death by hospitals and funeral homes and their workers to abide by? And are there funds available or sources for them to obtain protective equipment or guidelines for their work?
So the funeral, yes, and our fire chief is nodding his head yes. There are resources for our funeral homes. Obviously our hospital staff have access to PPE, and they are obtaining that through their channels. I know that our funeral homes here we work closely with, and I believe that they've put in requests through the state as well for additional equipment. We are seeing a nationwide shortage of all types of PPE. So I do want to thank the community. We've put out through Health and Human Services and Fire and Police, we've put out the requests to the community for masks, gloves, gowns. We've gotten a lot of stuff from our residents, and we're very thankful for that. But there is a lack of equipment. And so, we are working with our funeral home directors to make sure that they're protected and that they have enough equipment as well. So there are guidelines they have to follow. There are steps that they take, and then there's equipment that they have to wear. So, yes.
Great, thank you. Question, has there been any planning done to allow the Robbins Library to open with limited book pickup on request capability if the shutdown continues? I'll take that one. We've been talking regularly with our library director, Andrea Nicolai, and right now we've not deemed it safe to reopen the library for people to go back in to pick up books. However, they've really been putting a lot of effort into their virtual programming. That said, if the governor was to announce a significant extension in the essential services closure past May 4th, which is honestly quite likely, I think we'll keep talking about it and determine whether or not there is any further services we want to provide from the library. So I don't have a concrete or a conclusive answer to that, but it is definitely something that we're regularly talking about. Here's a good one for us. Last week on a beautiful day, my college-age daughter and a friend were sitting in Robbins Park talking to each other 6 feet apart, each with masks. Other families were in the park as well distanced and not on the playground, just enjoying the day. A police car pulled in and drove around the park and used the intercom to tell everyone to leave the park. What is the town policy? How does this differ from taking walks together at a safe distance, which is allowed and encouraged by the town? How will the APD balance this as the weather gets nicer and more people and families go outside? We probably all have a little bit of a take on this. Christine, do you want to start?
Sure.
Do you want me to?
If you want to start, that's fine. Yeah.
I mean, I guess I'd start by saying we are really encouraging people not to congregate in parks. We've been saying for a while that passive use of the parks is what we're encouraging. So walking through the park, either walking around or through the park or on your way to somewhere else is fine. We've really consistently discouraged congregating, and it does sound like what's being described in this question is congregating. So we have been asking our police department to tell or ask people to stop congregating in public places. So that would be my answer. I don't know if Christine or Julie want to add anything to that.
I'll let Julie go.
Yeah, that is correct, Adam. We're strongly suggesting that they don't congregate, and what's described is that sounds like people were congregating in parks. And we do have concerns for when the weather does get nicer, and we'll keep going out and talking to people and educating people about safe distancing and being safe.
Great, thank you. Try to squeeze in a few more here. I know that our trash pickup is outsourced, but those workers are also without face masks and not all with gloves. Does the town have any power to require those workers to wear that protective gear? I would say I don't believe we contractually have that ability, but I would imagine through the Board of Health we could do that. So I can talk with Christine and Mike Rademacher, the Public Works Director, and see about getting that done. That's a good suggestion. We'll try to take one more, and then I'm going to do my best to save the remainder of the questions so that we can try to provide answers to folks. Other than info available through the Council on Aging, has the town systematically determined which residences may have residents that need critical assistance should the crisis persist much longer and get more intense, especially these people who have limited access to technology? Christine, do you want to take a shot at that?
Sure. So the Council on Aging staff, I think that's our key in this this part of the response in our community. They've been reaching out regularly to residents that we know are definitely in need. They've been providing food resources, just daily check-in calls with our social workers. They've also set up Zoom exercise classes to keep people connected. So there are definitely, I know that that's, somewhat not accessible for a lot of people that may not have access to, electronic devices. But, I think in general, the social workers that work in the Council on Aging know, and I know that the fire and police also know who our critical residents are. We also work closely with our housing authority director and staff to identify others that may be in need. We regularly receive phone calls from family members that may be out of state that want us to check in with their older relatives. And so, we are definitely, the Council on Aging is definitely working around the clock doing that. I would say, we work 35 hours a week regularly. I think that they're working way more hours each week at the Council on Aging, just to make sure our senior population is protected and covered during this pandemic, because they are the most at-risk group at this time.
Great, thank you, Christine. So we're right at 3 o'clock. There's still about 19 questions. I just copied and pasted them and put them into a Word document. So what we'll do is take those questions over the next few days, put together a response list, and then post them on the town's website. So if you've asked one of the questions that hasn't been answered, I'm sorry that we haven't been able to respond to it today, but we will do our best to put together a response. And I think from this turnout today and from the level of interest, we've definitely learned that doing another one or multiple more sessions is certainly in the town's best interest. So I want to say thank you again to Christine, Julie, and Kevin for their work today and their work throughout this crisis. I want to thank ACMi for trying to make this as broadly available as possible, as well as Joan Roman, our Public Information Officer, who's been working with ACMi on the broad distribution of this. And I want to thank everybody who participated today. I'm really pleasantly surprised to see that we had nearly 140 people participating at one point. That's really, I think it shows how just how engaged people are in this community. And most of these questions seem to be questions really based on care, right? How are we caring for ourselves? How are we caring for our essential workers? How are we caring for one another? So I'm very appreciative of that. So we'll wrap up for today. Again, thank you to everybody, and stay tuned for responses to the questions posted on the website, as well as future scheduling of another town forum so we can continue this dialogue. And in the meanwhile, please everybody stay safe and well. Thank you.
Thank you.